Welcome back. Good to have you along as always. You're watching Ozarks Tonight. I'm David Oliver. You have certainly heard us in the news report a lot on the opioid crisis, not just in the Ozarks, but across our nation. And a lot of local entities are doing what they can to try to help fight that, get people some help. The Cox Health Foundation recently received a $1 million grant that's going to help the foundation and various providers to get some more of that help into rural parts of the Ozarks. We wanted to learn more about how that grant money is going to benefit people suffering here in the Ozarks. We've invited Brandy Van Antwerp to join us. She is the grant administrator for the Cox Health Foundation. Brandy, good to see you.
Good to see you.
Tell me, first of all, we've done some reporting on this grant. It's a federal grant. It's $1 million. You wrote the proposal, the grant for this. Talk about how we obtain this money for Southwest Missouri.
Sure. Well, so we have a lot of partners throughout our system. So, you know, Cox Health is a large health system.
Right.
And we have hospitals in Branson. We have one in Monette. We have one in Lamar. And then, of course, everybody knows more about Springfield, you know, as a Springfield listener. But we, what we did was we saw this grant come about, and when we heard about it, we reached out to all of our partners in those areas. So this grant touches Barton County, it touches Barry Lawrence, and Stone and Taney counties.
Okay.
So what we did was we pulled together a consortium and we said, what do we have as resources in our communities right now, and what gaps do we have in our communities right now to help with people who are battling the opioid crisis, so opioid use disorder or substance use disorder.
Sure.
And so we went through a discovery process with those agencies, and so it's 15 total partners that we have in this grant.
Okay.
And through that discovery process, we really identified key areas where we knew we could do more. So this grant itself asked us to do 3 kind of prongs. So focusing on prevention, on treatment, and on recovery. Now, Cox Health as an entity, we only do one kind of segment of that, right? We typically are seen in the treatment area. But what we wanted to do as an agency was to reach out to those partners and determine, would this money be useful if we all spread it out amongst those 5 counties, amongst those 15 consortium members, to determine what can we do for those key areas.
So those partners are going to help you with the prevention and the recovery component, which you all, again, aren't normally associated with because you don't do the treatment usually.
And even in the treatment side, we have partners like Jordan Valley and Burrell Behavioral Health. So depending on what counties we're talking about, we have partners that are taking on each and every one of these components.
Sure.
So we're working with the county health departments in all 5 of the counties for the education side, and they're working on school-based and community-based education on the prevention piece, which is extremely helpful. As we know, we've seen a spike in opioid use and substance use in our communities, and something that they can do is take the curriculum that they had existing that's approved and, you know, like a well-known type of curriculum that they're utilizing, but it allowed them an expansion of that. So we were able to pay for part salaries for those staff members at the health departments to increase the education in these communities. We really hope that we're preventing for youth before they ever experience anything to do with substances, but we're also helping adults who may come in contact with or have come in contact with these substances before.
I'm assuming as you were preparing this and writing this grant and going after this money for the foundation, obviously there was a federal acknowledgement that we have an issue that needed addressing in those rural areas because maybe they aren't getting as much attention as the metropolitan areas, like Greene County, let's say.
Right, exactly. And that is what the goal of this federal fund was, to help those rural communities. And so in the year preceding the grant application, we did our research and found that there were 46 fatal and 1,150 non-fatal overdoses in all of these 5 counties combined. So those are reported. You know, we have some things that we're working with on the back end of healthcare too, to determine sometimes there are deaths that occur that may have a primary causation that is actually reported on the death rather than that secondary cause, which may be drug related.
Sure.
So it's even looking into that, and that gets into the minutia of healthcare, but it really is a community effort, and that's where we saw a need for it, and we knew as an agency that Cox Health could put our name to this, but also work with all of these wonderful partners that we have to try and bring money into this region to help.
Before we went on the air, you and I were talking, and I think it's interesting if we all stop and think about it. You know, you're a grant writer, and you're writing this grant. 20 years ago, these types of grants weren't even heard of,
Right.
weren't necessary. And it's interesting how things have evolved, and this is now such a major issue, not just in Missouri, but all over the place.
Right.
I mean, it's just it's kind of it's an epidemic, obviously.
It really is an epidemic, and we fully believe that these efforts will help with it, and it takes a concerted effort. It also takes that collaborative effort of these agencies. And so what we're doing with this grant, we have a grant coordinator who was hired to take on this program and make sure that all of the activities are seen through, that the budget is spent as promised to the federal government. But he's also meeting with our regional coordinators and our regional kind of groups that subsist within these counties, right? And he's making sure that their activities are taking place.
Sure.
So these counties are coming together and having their own meetings. And then we have quarterly meetings between the large consortium, and we try to do them in person. So far we've had one, and we had a pretty good showing of everybody from all 5 of the counties together. So it's really all about increased communication and increased collaboration. When spikes occur, which we've seen in the media recently, of overdoses, we need to know kind of where they're coming from, and having that collaboration and that communication among these agencies can really help to pinpoint what's causing that spike in overdoses.
Right.
So all of our agencies want to work together to try to take care of this issue.
We've got about 20 seconds left here. What's your number one hope that we accomplish through this? Just personally, what do you think?
Oh, goodness. Well, if we could really see a tremendous drop in overdoses, I think we would be doing ourselves a great service for our community.
I think you're probably very right on that. Well, again, you've learned more now about the $1 million grant that Cox Health Foundation has received to help battle this crisis now in rural areas of the Ozarks. We talked about those certain counties that are going to benefit from this program that's going to focus on prevention, treatment, and recovery. So Brandy Van Antwerp, thanks for being here. We appreciate it. And if you'd like to know more about this particular grant, we've done a lot of reporting on it, and you'll find those stories on our website at ozarksfirst.com. More Ozarks Tonight after this quick break.